cognitive issues, and very happy to have Amy Morgan and Lauren Pollak here to address cognitive issues both in children and adults with Lou condition. Thank you.
So, good afternoon, and thank you for having me here. So I'm discussing, the talk was to be on cognitive supports for children with ALD. And it's so much more complicated than just cognitive supports, because children are complicated little creatures, and there are so many things that go into this higher order cognitive control for them. And this is kind of an example of, we're looking at cognitive skills and learning skills, but there's also the physical, the behavioral, social, emotional components that really underlie a child's ability to use their higher order skills, the cognitive and academic or learning skills. And then children who have any sort of central nervous system involvement also require more supports from the environment than a so-called quote-unquote typically developing child would. And so the effects of family and educational and psychosocial supports are very important for every child, but triple that, if you will, for the child who is involved. And so what I'm going to talk about is the childhood onset ALD, the cognitive and academic skills, physical and sensory processes, et cetera, and then turn it over to Dr. Lauren Pollak, who will then address the issues often evident in adult onset ALD. And so children vary so much when a disease hits, and it depends on their level of development or developmental level when they're affected, and then also the severity with which they're affected. And it can range from severely impaired to only mildly, barely able to detect the effect of the disease. And so it's difficult to come up with kind of a one-size-fits-all intervention for them, or even way of thinking about it. So what I wanted to do, I think more than anything, is discuss kind of the philosophy of a child's cognitive development. And so when children with childhood and not infant onset are first affected, there's weaknesses often in just attention, executive functions, which kind of go hand in hand, and visuospatial skills. And so attention, we all kind of know what that is, but executive functions are, grossly speaking, the ability to pay attention to what's important and to plan and organize one's approach to things. And also speed of information processing is very much involved, and working memory is very much involved, and those are kind of the underpinnings for learning, how quickly one can think and how one can hold information in their mind while they're working on a problem. Visuospatial skills are hard to kind of talk about. They're not just having pictures in your head or the ability to read maps, but also they affect cognitive functions in your ability to categorize information, kind of gauge the relationship among different ideas or categories, and categorize the objects. And part-to-whole relationships are also affected by visuospatial functioning, and that's the ability to kind of see the forest for the trees. And not just see the forest for the trees, but know when to concentrate on just the trees and which trees, and when to kind of zoom the focus back and look at the big picture or the forest, and how to shift attention back and forth between the two. And then we have the physical and sensory skills, which are critical to supporting cognitive or thinking functioning. So those, grossly speaking, are apraxia, and that involves motor planning, the ability to think about what you want to say and then plan the movements of your mouth, the motor components of speech, in order to use speech appropriately. and visual and auditory functioning or sensory dysfunction, which Kellen did a great job of going through all of that. But suffice to say, just whenever your sensory processing is affected, your ability to interact with the world is severely compromised, or at least somewhat compromised. And then motor skills, which has been discussed quite a bit. Then there's the emotional, social, and behavioral aspects of a child's functioning, which really affect their quality of life. And so peer relationships are critical for a developing child. It's really, in addition to family, the way a child learns about him or herself. And so those can be difficult in some cases to support, and special attention must be paid to those. In addition to a child's ability to self-care and ability to manage their environment, whether it be due to motor difficulties or sensory processing difficulties, and then their confidence and just their ability to effect change, their self-concept. And then the behavioral issues, which one can see sometimes, they're related to attention deficits in some cases, and then they can be related to issues, inability to make sense of and negotiate the environment. And so if a child, I'm thinking of one in particular, who can't see and has difficulty processing auditory information, can't tell speech from environmental noise, his ability, in this case, to make sense of the world is so severely compromised, and even whether he's standing upright or what his position is in the world, that of course that results in some behavioral processing difficulties. And so the most important thing, in my opinion, is a multidisciplinary approach. So not just thinking about cognition, not just thinking about the motor system, behavior, etc., but all of the things and how they affect a child's well-being. And as I had mentioned before, children are more affected by the environmental factors, including home, peer, and school environment, when their CNS has been affected. And then, because home and school are so important to a child's well-being, paying attention to caregivers and their emotional well-being and physical well-being, and to sibling supports, which has been already discussed. But I think parents in particular have to give themselves permission to care for themselves, because that's so important, if for nothing else, to their child's well-being. So for a child who is severely compromised, we think, kind of at the lower level, if you will, of processing or making sense of information. So we're not quite to cognition yet, but we want to, when a child is severely affected, one of the things, once their physical and medical issues have been taken care of, their ability to maintain connection with the world and with their caregivers is very important. And so we know that their ability to respond to the environment is decreased, and so we want to pay attention to all of their senses, motion, hearing, smell, touch, and sight. And there's been, I think, what I'm aware of is no research on this for children with ALD. And so just kind of going to the literature and finding good research on other populations that have severe or significant CNS involvement can be really important for the children who are very more compromised. And so looking into literature about significantly prematurely born children, because their nervous systems are very affected. Even children with advanced cancer, there's been a lot of research on that. So culling that together for the children, again, who are more severely affected, one of the things that's been very effective for these children is to tactile or touch stimulation, which has to be used very thoughtfully, and usually in initial consultation with a professional, either an OT or PT or a massage therapist who has experience working with this population, because as much as it can reduce cortisol or the stress response to the environment, it can also, if it's not used appropriately, it can also cause distress. If it's, for example, very light touch in some cases, that can be actually very disruptive to the child. But touch therapy is also a way, once the caregiver is educated in how to provide it, it's a way of bonding with their child. It's a way of doing something that actually is making a difference for the child. Hearing the effects of music when auditory processing is so significantly impaired that speech is not processed appropriately, music can be a way in and be very soothing for the child, and you have to work with your child to make sure that you're sensing that the music you're providing is most appropriate for them, or actually soothing for them. Some of the things that when auditory processing is most severely affected is music that is in maybe 10 to 15 minute intervals, that is a kind of a lullaby sort of music, can be very soothing. And smell, another important sense, and lavender scent in particular is associated with reduced cortisol, particularly in the premature population, and again, in a population with a nervous system that's been significantly affected. And so I know there's probably other sorts of smells or odors as well, but I'm not as familiar with the research on that, and I don't know that it's been researched. So now for the more highly functioning children, we're looking at school interventions, and there are school interventions for the children who are more severely compromised as well. But we want to make sure that assessing functioning in each domain is very important. So reading, writing, psychosocial intervention, motor skills, visual skills, etc., and that supports are in place for every affected area, and ways of measuring progress in those areas also. Regularly scheduled consultation with the education team, I believe, is really important. It keeps the educational team, first of all, focused very specifically on the child and with all the domains affected. And also we're assessing the child's response to the intervention so that tweaks or changes can be made along the way on a relatively consistent basis, instead of waiting, 6 months or at the end of the school year to find out that, well, yeah, that really didn't work this year. And so kind of fine-tuning it along the way. Occupational, physical, and speech language therapies, most often each are going to be important, but it varies a lot from child to child. And so I would recommend, really for every child affected, an evaluation with someone like me or like Dr. Pollak, so that we can hone in specifically on your child's strengths and weaknesses. And also appropriate sensory, auditory, and visual supports, the Perkins School being one that provides incredible supports in each of those domains. And then broadly speaking, for the child who is very high functioning and may have just minimal or barely detectable weaknesses, one of the things we almost always recommend would be additional time, because the speed of information processing is often most affected because of the myelin, which is responsible for fast transmission of information. So additional time, accommodations for attention, even if they're minimal, but it can be anything like seating, preferential seating in the classroom, getting the child's attention before conveying appropriate information, delivering information in smaller chunks to the child, And then kind of feeding into that, the executive function supports for in-class work and for homework, and using the classwork and the homework as tools to help the child learn more strategic ways of thinking and dealing with information. So you're not adding another layer of they have to do this onto their day, but using math, using reading comprehension, written expression, etc., as ways to learn tricks to deal with information more efficiently. And then peer and social supports are critical. And for some children, it can be, if they're very low functioning, can be a visit to the classroom by a professional or even a parent, helping the class or the school understand what's going on with your child. That, you know, for example, Johnny has difficulty processing information or making sense of things, even though he really likes, you know, interacting with or hearing you talk to him and touch him, etc. And children are wonderfully responsive to things like that for the most part. Two, much more informal supports for a higher functioning child who may just have difficulties, have a lack of confidence, etc., in dealing with peers. Mindfulness is, I think, critically important because it helps make us more aware, being present and aware of what our bodies are doing and feeling. And also, research has shown quite robustly that it also, if done properly, results in improvements in executive functions and hence academic performance. One of the activities that can promote mindfulness is yoga, which is good for a variety of reasons, but also for mindfulness. There's also certain types of mindfulness-based therapies for children and adults who are higher functioning. Cognitive behavioral interventions to also reduce anxiety and executive functioning skills, and there's well-known therapies for the, well, CBT, cognitive behavioral therapy, for that. And intervention in these areas, in the mindfulness domain, is often associated with improvements across the board and can improve coping skills and school adjustment. And now to move over to the adult version of difficulties, I'm going to turn it over to Dr. Pollak, and then we can take questions afterwards.
Okay, hello everybody. I'm very happy to be here. So I'm going to be talking about the other end of the age spectrum from Dr. Morgan. I'm also a clinical neuropsychologist here at Mass General, and I, over the past 6 or 7 years now, have had the pleasure of working with a number of Dr. Eichler's patients with adult onset ALD or AMN. So what I'm going to be doing is try to sort of supplement what Dr. Morgan just talked about by discussing how we might try to ameliorate specifically cognitive difficulties that individuals with adult onset ALD can experience. So notice I have these sort of asterisk possible cognitive difficulties in adults with ALD. Many individuals in this room likely recognize that not everyone with adult onset ALD or AMN experiences cognitive difficulties. But for those that do, the most common concerns that they present when they come to a neuropsychological clinic, such as ours, are generally fall into 3 categories. So they'll describe attention difficulties. This might include things like having trouble sustaining attention or feeling like their slowness or their ability to process information is slowed. They'll often report that various executive functioning skills are compromised, and Dr. Morgan touched upon executive functioning skills a little while ago, but this would include things like having trouble initiating tasks and following through with them, experiencing trouble planning and organizing within their day, having trouble multitasking, maybe having trouble approaching a complex problem, figuring out how to do it, and if that approach doesn't work, what other solution they might try. And then many folks report that they have problems with memory or they experience difficulties with forgetfulness. And as I'm going to allude to in a moment, oftentimes the memory problems are actually related to the attention and executive functioning difficulties. They're not a true memory problem per se. So I will get to that. So what I'm going to do today is to talk more specifically about strategies to improve cognition. I'm really going to focus the bulk of the next few minutes that we have to talk about the practical tools and techniques that you might incorporate into your daily life. I'll talk a little bit on my last slide about a couple of lifestyle factors that we might try to sort of address as another way to improve cognition. And I do want to say here that as a neuropsychologist, really our main role is to evaluate for the presence of cognitive difficulties. Most of us aren't formally trained in these interventions. Oftentimes what we do is sit with patients in a feedback session and go over strategies, maybe include them in our written report and refer on. But I will say that over the past year or so, I've had the opportunity to try to implement some of these strategies with patients. It's been a nice addition to my role as a clinician. So I'm going to go over some of these strategies today. This certainly isn't a comprehensive list, but hopefully you'll have some helpful nuggets to take home and maybe incorporate into your daily lives if you're experiencing cognitive difficulties or if your kids are, because these strategies could apply to children certainly as well. Okay, so I'm going to talk about memory first and foremost, because memory is really the most common cognitive concern that's voiced by patients who come in for neuropsych testing, including folks with ALD. So the strategies I'm going to talk about today includes improvement of our attention span, our attention capacity. I'm going to talk a little bit about external tools we can use in our daily lives, and then also mnemonic or internal strategies. And I'll go into more detail about what each of these are as we come to them. So with respect to attention, most of us have a limited attention span. And it can be helpful to really think of attention like a flashlight. If you're in a dark room, if you have a flashlight with you, you can use it to illuminate the most important information or things that you want to see. So if we think about our attention that way, we really want to focus our attention on what's critical at that moment. And so what can we do to sort of focus that attention flashlight, focus our attention on what's most important? So the first thing we can do is set up our environments for success. So this includes doing things like minimizing distractions. If we know we need to work on something important, then it would be important for us to do things like to turn off the television, our computer. If we can't control extraneous noise, like if our house is next to a busy highway and there's nothing we can do about that, then maybe put earplugs in, or close the curtains to sort of block out at least our sight of the road. Also, I find that it's really important for me to get rid of clutter before I sit down and focus on something. So if I'm going to do something that requires sustained mental effort, it's better if my desk or table isn't covered with clutter, because when it is, I'm much more likely to get distracted away from what I'm doing and notice, that my phone's lighting up, or, oh, there's a bill that I really need to pay. So get rid of that clutter beforehand. Avoid interruptions. So if you know you've got to work on something important and you're at home and there's other people around, maybe close the door, put a do not disturb sign up, or notify people that you can't be interrupted. And then yet another sort of strategy for many folks is to avoid crowds. Sometimes people find that they really have a hard time maybe going shopping in a crowded market, and they just can't get the task done as efficiently when there's a lot of people around. So if that's the case for you, then find a time of day where you know that supermarket is not going to be crowded, or wherever it is you need to go. Okay, so another important strategy is increasing our focus on the information at hand. Number one, slow down. The things that that we do in our daily lives end up being done on autopilot. So, we come in the door, we throw our keys down and move on to the next thing without even realizing where we put our keys or paying attention to it. So really, if you're recognizing that you're having problems remembering things you've done, see if you can just kind of take a step back, don't hurry so much, kind of think through what you're doing, and notice also the details of your environment. So when you put those keys down, notice exactly where you're placing it. Pay attention to where they are or where your eyeglasses are going. Along those same lines, a strategy I recommend to a lot of my patients and that they find very helpful is something that's called the see it and say it strategy. This is not one that I made up. I kind of took it from a cognitive rehabilitation book that I've been using in my practice. But this strategy can come in particularly helpful if we're planning on doing a task. So many people talk about this tendency to sort of walk into a room and get there and think, oh, what was it that I meant to do? That's one of the most frequent complaints that people voice to me when they talk about memory problems, and I certainly do it myself. So let's say you need to go into your bedroom and retrieve your eyeglasses from the nightstand. Instead of just heading on over to the bedroom to do that, maybe take a moment and sort of close your eyes and visualize yourself going into the bedroom, looking down onto the nightstand and picking up those glasses, and tell yourself, I'm going to go into my bedroom, go to the nightstand and pick up those eyeglasses. So you visualize the task and you say it to yourself, and doing that not only increases your focus on the task at hand, but it increases the likelihood that you're going to encode the thought more deeply and remember it when the time comes. Get actively interested in what you're doing. You're more likely to remember something that you're interested in. When you're learning something or experiencing something, and it's more it's more emotionally laden, then the amygdala in the brain tends to become activated and release chemicals that then enhance the ability of the hippocampus to lay down the new memory. So if you think about 9/11 and what an emotionally laden event that was, probably everybody in this room can remember what they were doing when they heard about the planes crashing into the Twin Towers, who they were with, who told them. It was a very emotionally laden event, and one that most of us are not likely to forget. Obviously we hear about it repeatedly, but nonetheless, it's just an example of how when something is more emotional for us, it's more likely that we're going to call that memory up later. So when you're having a conversation, in order to make the information more emotionally meaningful, ask questions of the person who's talking to you. Perhaps repeat what they tell you to make sure you're understanding it correctly. And ask yourself how the information makes you feel, and perhaps you can even relate it to something that's personally relevant. When you're listening to me talk now, if you can think of examples of memory lapses you're having in your daily life and make this relevant to you, that's going to increase the likelihood that you will remember some of the things we're talking about. So I'm going to briefly touch on external tools. This is one example of a strategy that we can also use to improve our memory. External tools are simply devices you can carry with you or place in your home that will help you remember information. We all use them. Examples would include a date book or a pill box. They can include things like timers, alarms, our GPS, even things like a key hook or a basket in which to place commonly used items so you know exactly where to find them. And what's great about external tools is that they allow us to free up our brain. So we don't have to remember everything. And if there's something that's particularly important that we're afraid we're not going to remember, we can use that external tool to decrease the likelihood that we're going to forget. So some tips on using these external memory aids would include things like not wasting time. Use the organizational aid right away. So if you're in a doctor's appointment and they tell you, okay, this is when I want you to come back again, write that information down right away, because the chances are probably pretty good that you're going to leave the office and go, what was the date that the doctor told me again? keep the aids as simple as possible. Try not to keep multiple calendars when you can just have one. I'm a bit guilty of this. We have our home calendar, I've got my calendar on my phone, I've got my work calendar. I know I need to centralize those, and that's a goal I'm striving toward, but the more that we can do that, the more likely that the external tool is going to work. Make the use of the external memory aid routine. It can be hard for us to get used to doing things like taking notes or keeping calendars if we're not accustomed to doing, if we've never had to in the past. So it can take some time and some practice, but eventually if you keep at it and keep trying to use these external aids, then they're more likely to become a habit. So there are the external strategies contrast with internal strategies, and these are strategies that we use in our in our head or in our minds. This is just a list of a few internal strategies. There are many more out there, but these are some of perhaps the more common. These include repetition. We all know from studying for exams that the more times we went over the test-taking material, the more likely we were going to remember it on the date of the test as opposed to cramming the night before. So we can use that to our benefit when we're not in school as well. When you're having a conversation, for example, with a doctor, if you repeat what they told you, maybe repeat the information to your spouse or a friend, just to sort of ensure that you're encoding it more effectively. Make connections and associations with the information that you're trying to learn. So one example would be if you're meeting somebody new, maybe try to connect the person's name with something else about them to make it more likely that their name's going to come to you later. An example might be if you met a woman named Carla and she happened to have curly hair. You could think of her as curly-haired Carla, and in all likelihood, the next time you see her and you notice her curly hair, unless it's pulled back in a tight bun, the name Carla is going to come to you much more readily. So there are many other examples like that, but and then visual imagery is yet another strategy we can use, pairing up maybe a verbal, something somebody said to a visual image. So this is not an example of converting a verbal image to a visual one per se, but we park our car. Oftentimes we can't remember exactly where we parked it. I mean, certainly you can take out the cell phone and take a picture of the spot, but another thing to try would be, let's say we're parked in 2B. You can think of two bumblebees, and stinging you, and just create this vivid, sort of bizarre image, and perhaps it'll increase the likelihood that you'll remember where you parked the car later. Okay. Tips for using internal strategies. It takes effort and motivation to use them. They don't really come naturally to most of us. Think about a strategy that might help you, because some of these strategies may not be the most effective for everybody. So there's it's sort of what seems to work for you. Practice makes perfect. The more you use the strategy, the more successful you'll be, and the more automatic it'll become. And I guess I just said this already, do what works for you. Not every strategy works for everyone. So the last thing I wanted to talk about, and unfortunately I didn't devote a lot of, I've only devoted one slide to this topic, just sort of knowing we'd be short on time, but as I mentioned earlier, there are a lot of lifestyle factors we need to take into account that can impact our cognition. Things like our physical health, as well as our emotional health, as well as various habits we might engage in, smoking or drinking alcohol, what have you. These are things we may have some control over that can secondarily improve our cognition. And I wanted to focus more on emotional health and its impact on cognition, and just bring up 2 points. One is that it's very important that we do our best to manage stress within our daily lives as a way to improve cognition. Stress is something that we all experience, but when it's happening at a heightened level and it's chronic, it can impair our attention and our memory. So there are all sorts of things that we can do to try to manage stress within our lives, and included among these would be things like engaging in pleasant activities. For some of us, that may be taking a walk, reading a book, watching a funny movie, talking to a friend on the phone. The list goes on and on. There are deep breathing exercises that you can engage in that will help relax us. But certainly, if the stress is really debilitating and chronic, you may need to talk to a professional and see what they can do to help you to manage the stress more effectively, because it may just be too challenging to do on your own. And then the last thing I wanted to emphasize was the importance of getting a good night's sleep. And so there are a host of behavioral strategies we can adopt that can help with this. And listed on the slide are only a few of those, but things like avoiding taking naps, as hard as that can be. But if we take too many naps during the day or a lengthy afternoon nap, it can certainly impact our ability to fall asleep at night. Avoiding taking stimulants, particularly after lunchtime, establishing a relaxing bedtime routine. And kind of a big one is if you get into bed and you're lying there awake for like 20 minutes or so and it's just you're not falling asleep, then really what's recommended is you get out of bed, do something that's relaxing and boring, and then go back into bed later, because otherwise what ends up happening is you start to make this association between your bed and sleeplessness, or your bed and anxiety, and it's a tough cycle to break. So, okay, so that's my last slide.
Thanks so much, Laura. Excellent. So we're only running an hour and a half behind, right? So, and I think Kathleen had just offered to do some hot yoga in the hallway. So I just want everybody to just be, as we're listening to all this, still be feeling the blood moving through their body, not feeling that they're sitting so long that they can't be actively contributing. So I think in line with what you just heard, please come forward with questions around cognition strategies and resources.
Dr. Morgan, is it?
Yes.
Thank you. I just wanted to clarify on your presentation for children with ALD. Was that presentation mostly geared towards a woman carrier having a girl, and then that girl predominantly getting those types of symptoms?
No. But why do you ask that, though?
Well, as I learned about this, disease and condition, and that the woman, as it gets passed down, is from woman to woman. The
Right.
woman is the carrier.
Right.
And if the woman has a girl, then that girl then becomes a carrier, correct?
Yes.
So then I thought, that girl can, maybe as a child or as an adult, develop ALD symptoms. So based on your presentation, I was thinking then that girl could be at more risk because the mother was the carrier, and whereas a boy would develop it more or less like as a young child, like Amen or Addison's. Could the girl, those are the effects of the girl, cognitive learning. Does that make sense?
It does make sense. And so boys are more adversely affected by ALD. Girls can be affected usually as they get older, the carriers, and the effects can range from mild motor difficulties to some mild cognitive difficulties. And Dr. Eichler might be able to speak more to that, but my presentation was geared primarily to the boys.
Oh, it was towards the boys.
Yeah.
Oh.
If I could just add that, and boys, depending on when the onset is, their patients I have, for example, can range from significantly impaired, where visual processing is affected, auditory processing, everything is affected, and they're very low functioning cognitively, to very high functioning boys that we just monitor to see how the disease is progressing.
Like me.
Yeah.
Is that like you? So like you,
Because, why would you say, or could you guess why someone like myself wouldn't have those cognitive, defects, so to speak, as a child. But then as age progresses, kind of gain some in the extent of just saying adrenal issues, but not cognitive so much issues. Like, is there any rhyme or reason to that you've seen, or is it just like the luck of the draw type of thing, and you get what you get because of mutations is what it is?
So should I speak to
Yeah,
that?
yeah,
So,
go ahead.
so let me try and make this simple. Girls, as they get older and who carry the gene, are at risk of developing AMN. They do not develop cerebral ALD. Okay, so the boys, if they don't develop ALD, brain disease, as children, and they go on into adulthood, they invariably develop some degree of spinal cord disease, AMN. They are at risk of developing brain disease, but it's much lower than that risk than in boys. Okay? So I know it's complicated because of that combination of brain disease on the one hand and spinal cord disease on the other, but you really have to separate those two in order to interpret and understand what I think Amy and Lauren were talking about. So I think some of the processing problems that we are worried about in adults and are related to brain disease are pretty rapidly progressive. That occurs in a small minority of cases. Okay, but these are not the kinds of things that a patient with AMN, with spinal cord disease, would be worrying about. Okay. And I know it's probably a longer discussion, but just for the
That's fine.
Okay.
Okay, thank you.
Thanks so much. So, just in the interest of time, I thank you again to Amy and Lauren. Thank you.